Welcome to today's webinar on cholesterol. My name is Jane Wingert. I'm one of the nurse health coaches, and this is about a 15-minute webinar. So let's get started. We'll start with objectives, just so we know where we're going. And we're going to learn about cholesterol, what it is, what its significance is, identify a few cardiovascular risks associated with high levels of cholesterol, and then also identify lifestyle components that contribute to or reduce risk of cardiovascular conditions. And these are, when I mention cardiovascular for this topic, it's heart attack and stroke. So what is cholesterol? It's a waxy substance like a fat. It is important for all our cells, particularly in the walls of the cells. And a couple of other things I have listed here because cholesterol has many different functions. So this is a very short list, of course. Hormone production, in particular things like stress hormone, cortisol hormone, it is needed. It's required also for vitamin D production. So often we think about the sunlight, but we also need cholesterol. And then bile acids, and that's an important part of the digestion of fats. So you can see that cholesterol really has a wide range of use. Our body actually makes all the cholesterol it needs. We get additional through dietary intake, so what we eat. Cholesterol is actually carried through the body attached to proteins. And so this is where we get the term lipoprotein, and you'll hear the acronym LDL and HDL, and that is referring to the good and the bad cholesterol. So I'll talk about that later on in the presentation. This is how cholesterol is delivered to different tissues and organs in our body. So why do we care about cholesterol? Well, in excess, it can actually combine with other substances and stick to the walls of the vessels. It actually kind of gets up underneath it rather than sticking right to the inside of the wall. And it creates this term called plaque. And plaque in itself can cause turbulence, can cause things to want to stick to it, kind of like a river that has after a storm, you see a lot of things in the river, and they kind of congregate in one spot, kind of similar to our bodies. So it can create turbulence, blockage, and then our risk for cardiovascular conditions will increase or can increase because of that. What is the good news? Well, the good news is that we actually have decreased the deaths from cardiovascular disease. And you can see from the short list, the first few are really related to treatment. So it's not preventing. It's not that we're preventing cardiovascular disease. It's actually treating it better. Angioplasty is the balloon procedure. Stroke centers actually are just improving how stroke patients are treated and getting faster interventions. Improved treatment for hypertension or the high blood pressure, and then improved treatment for high cholesterol as well. So the statin drugs are largely responsible for that. And then this last one, decrease in tobacco use, that's actually a lifestyle modification. So that's good news. There is less tobacco use from the data that I had. The not so good news is that it's still the #1 cause of death, cardiovascular disease for both genders. A large number of people die, so almost 1 million related to these conditions. And we're younger, people are having stroke. So that's the not so good news. So let's just get started on just a little explanation of lipids or a lipid panel and what that includes. So a lipid panel measures both cholesterol and triglycerides, and they're included together because they are both kind of a waxy substance or a fat-like substance in the blood, but they are different substances. We make the cholesterol that we need, And triglycerides are more of a storage system, so it's not actually that we're producing. It really just depends on what our intake. So when you have a biometric screening done, for instance, you'll see a whole bunch of numbers there, and the first three generally are cholesterol. You'll see the total cholesterol listed first, and what that includes is the lipoproteins that I talked about earlier. The high density is the HDL, the low density is the LDL, and then a portion of the triglycerides are included in that total number of cholesterol. So you can see where there be different reasons for elevated cholesterol depending on what these other components are. Normally, in general, lowest risk with a cholesterol level of under 200 milligrams per deciliter, so under 200. The HDL is considered the good cholesterol, and an easy way to remember which is which. H for happy. Most people associate happy with wanting to have a lot of happy, so you want to have a lot of happy cholesterol in your blood. Why is that good? Well, this type of lipoprotein acts basically like an escort or a scavenger. It picks up the excess cholesterol and delivers it to the liver. So I like cute little terms to kind of help me remember things. It's the liver deliverer. So it takes it to the liver, it breaks it down to discard it. And in general, the higher your good cholesterol, so the higher the HDL, the lower the bad cholesterol. It just kind of goes to reasoning. So you have a lot of good stuff around, it's getting rid of the excess bad stuff, so it helps keep the bad cholesterol in check. A couple other things: smoking, diabetes, inactivity, being overweight, and certain medications can really affect the good cholesterol in a negative way. So people will have lower good cholesterol, and that's where the risk is when you have levels that are lower than normal or lower than optimal. So I've just listed what kind of the ranges are for risk factor. If you look at the bottom first, the greatest risk is different for men and women. So for men, under 40 milligrams per deciliter, and for women, under 50. And then the top of the slide, you see the lowest risk. So if you have a number, and this is both for men and women, of 60 or higher, I couldn't get the equal sign there, so 60 or higher, that's the lower risk. It's actually seen as more protection against cardiovascular risk factors. And then the middle section is kind of like that normal range or moderate risk range. So 40 to 60 for men and 50 to 60 for women. And I have activity in a lot of these slides because it does make a difference in your cholesterol levels, physical activity. So I just put those in there, plus they're nice to look at. LDL cholesterol. LDL is known as the bad cholesterol, or as I like to say, lousy cholesterol. It's an easy way to remember that one. When in excess, or if in excess, these proteins just keep circulating. They keep going around, and that's where they tend to cause problems. Over time, the excess LDL can enter the blood vessel walls and build up under the wall lining. And so that creates that obstruction, turbulent flow, kind of an area for things to stick to because of that. Things that increase your LDL. Historically, we talked about saturated fats. We're now looking a little bit more towards the trans fats. Trans fats are probably the worst of the fats. In that they are artificial fats, basically. So things that are not found naturally, and they're made in the factory. So processed foods, that's something that if you didn't have processed foods, you wouldn't have trans fat. So that's something to look for when you're reading labels. So risk factors with LDL, we can start at the bottom again on this one too. Highest risk, 159 or higher, or 159, greater than 159. The lowest risk is under 100, and then that moderate risk is in between that 100 to 159. Now, this one historically physicians have looked at what other risk factors you have to determine, is this range okay, or do we really want it well below this 100 milligram mark? And that's something that's changing a little bit about, how they look at it, and they use a tool to assess that. So lipids are quite complex, but if you have high blood pressure, if you have other conditions like high cholesterol, kind of familial, so in the family, you have diabetes, you already had a heart attack or a stroke, often they'll want that risk to be, your LDL risk to be much lower, so they want the numbers lower. This slide is just talking a little bit about the different patterns of high cholesterol, because they are varied, and so it's a complex thing. That's why we have lipid specialists and physicians looking this over with you. So the first pattern is this low HDL, so that's the low good cholesterol is low. Remember, that's one that protects against some of those conditions. So this is low, and then the triglycerides are high. And often this is associated with things like insulin resistance, and frequently influenced by lifestyle and diet. So the good news is that these things can be modified by modifying lifestyle. This other pattern called high, or is related to high total cholesterol and high LDL. So that's the bad cholesterol is high and the total cholesterol is high. And this is a well-known kind of pattern for heart disease. That said, there's also combination patterns. So this is just two that I have listed. This type of high cholesterol pattern often needs kind of a combination of treatment, so not only lifestyle but medication, and that generally is statin medication. I did want to mention one other pattern, and it has a long name, and I often can't say it, familial hypercholesterolemia. And basically this is a genetic trait. It's autosomal dominant, which means you only need one parent to pass it on. And for those of you who like a lot of information, it's chromosome number 19. It is associated with very high LDL. So the bad cholesterol often is over 190. And if you remember, the high risk was over 159. So, quite high, greater than 190. But the triglycerides are normal. So this is something that definitely want to be under the treatment of a primary care provider. Triglycerides, as I alluded to, is it is a lipid. It's a fat, but it is not made by the body per se. What it is it's a storage system. So when you take in more calories than needed, so you're more calories in than expended, the body wants to hang on to that, and so it hangs on to that energy and stores it as fat, triglycerides, for later use. High triglycerides can be affected by inactivity, so your triglyceride levels will be elevated with inactivity, being overweight, smoking, high carbohydrate diet, and particularly carbohydrates that really don't have fiber in. So high sugar intake, white carbohydrates that are converted to sugar easily. Medications can also increase triglycerides, and some genetic disorders. So I have those listed here. Alcohol as well. The lowest risk is under 150, and that's really, there aren't really ranges to this one. It's just normal. We like to see it under 150. This one will really, this number will bounce around depending on calories in and calories out. Refined carbohydrates, again, cookies, cakes, crackers, breads, fluffy breads, you know, not the dense ones with the whole grains. Chips and soda, those are all kind of the hallmark of high triglycerides, so high intake there. This slide is just about the control that you have over the cholesterol levels. So no matter what the pattern is, there is some influence that you have. Diet, exercise, stress, weight, tobacco use, and then blood pressure. And these are actually risk factors that can influence cardiovascular disease. Nutrition in general, you want to include the good oil, so you don't want to be fat-free. You want to be a fat snob, so just including the good oils like olive oil, nuts and seeds, avocados, the good oily fishes like salmon and trout. Fruits and vegetables, I like to think of them as separate, not together, so that you don't eat just fruits. You want to include 5 to 7 servings per day, and then decreasing the trans fats or the processed foods. Easing up on the sugar, again, that relates to the triglyceride levels. Lower fat dairy, doesn't have to be fat-free. A lot of the fat-free products have added sugar, which is not a good thing. So it's okay to have a little bit of fat. And lean meat. Physical activity, the recommendation is 30 minutes of activity most days. And the best exercise is the one that you're going to do. Weight, if you have excessive weight, losing 7 to 10% of your current weight can definitely have a positive effect on risk factors, as well as, you know, how you feel on a daily basis, and of course your cholesterol. Tobacco use, lots of information on why this is beneficial, but I have these specifically related to cholesterol and cardiovascular risk. Your good cholesterol can increase up to 10% after quitting tobacco, and reducing heart disease risk after 1 to 2 years can be greatly improved, as well as reducing your blood pressure, which in turn decreases your risk. So really the choices are yours. Lifestyle modification can really make a big difference in risk factors, as well as you know, the cholesterol. And there's many reasons why people choose to make some lifestyle changes to feel better, fuller life, improve energy. Sometimes it's sleep as well, better focus, and of course that idea of role model for family and friends. So the things that make a difference on a day-to-day basis tend to be more sustainable type change rather than thinking of things way out in the future. So I have a few questions listed here at the end of the webinar. Take your time. Hopefully you gained a little bit of information, and thank you for participating.